with the Positive News. We're very excited to welcome Dr. Bogoch to the program today. Dr. Bogoch is an expert in HIV prevention and has been working with HIV patients for over a decade. Welcome to the Positive News.
Thanks for having me on.
I have a bunch of questions about HIV prevention. Do you mind if I just jump in?
Let's do it.
So how has HIV prevention changed in the last 30 years?
Well, I mean, over the last 30 years, there's been some very significant discoveries. We just have more tools in the toolkit now. We have treatment as prevention. We have PrEP, or pre-exposure prophylaxis, and we have PEP, also known as post-exposure prophylaxis. So we have lots of different ways where we can prevent HIV.
And how would someone get on those treatments?
Well, fortunately, it's much more available and increasingly available in Ontario. So people can speak with a healthcare provider about this. And of course, you can go on to ontarioprep.ca to find a healthcare provider who's knowledgeable in this area.
So what's the difference between PrEP and PEP?
So PrEP, or pre-exposure prophylaxis, is basically a way where we can prevent HIV in HIV-negative individuals who are at risk of getting HIV. We put them on a tablet a day, and it significantly reduces their risk of acquiring HIV. PEP, or post-exposure prophylaxis, is a technique that we would use if someone has already been exposed to HIV. We've got about 72 hours to start them on a medication. They need to be treated for 28 days. And again, that will significantly reduce the risk of HIV if they are already exposed to it.
You mentioned PrEP and PEP. I wanted to know a little bit more about treatment as prevention.
Basically, what you do is you screen a population or a cohort of people for HIV. Anyone who's positive for HIV, you provide them with antiretroviral therapy. You provide them with treatment. And we know that if people are on treatment and they stay on their treatment and their viral load is suppressed, we know that their risk of transmitting HIV to other individuals is about 0%, meaning you can truly live a long, healthy, happy life with HIV as long as you're on the medications. You are protecting yourself, but you're also protecting those around you.
Who would you recommend PrEP to?
PrEP is really for anyone who's HIV negative, who's at greater risk for acquiring HIV. So that could be acquiring HIV because of sexual contacts, because of injection drug use. There's a variety of ways that people can get HIV. Anyone who's at greater risk for HIV can certainly speak with a frontline healthcare provider about pre-exposure prophylaxis, or PrEP, because it is a very, very effective tool to prevent HIV.
And in your opinion, what's the most effective way to prevent HIV?
Well, there's so many different ways that we can use to prevent HIV. This has to be tailored to the individual. So what's right for one person might not be right for another person. And this is why it's so important to sit down with a healthcare provider who knows this stuff well, who can walk individuals through what's best for them.
How have the advancements in HIV prevention impacted some of your patients?
Yeah, this has really had a profoundly positive impact on so many people, including many of my patients. These are individuals who are at risk of HIV acquisition. You can imagine the anxiety that that would cause and the mental health issues that that could exacerbate. They basically know that their risk of HIV is dramatically reduced and sometimes even eliminated with these modern HIV prevention techniques.
Any lasting words for somebody who is looking into HIV prevention?
There are a growing number of HIV prevention providers in Ontario, and certainly if people are interested in finding one, you can go on to ontarioprep.ca to find a provider near you who's capable of walking through all the details and nuance of HIV prevention and starting someone on an HIV prevention care that suits them.
Thank you so much for being here today.
My pleasure.
For those at home, thanks for tuning in. Stay tuned to PositiveNews.ca for more good news.